Welcome back, everyone, to the Beyond Clean Brushing Up on Quality Dental Reprocessing Virtual Conference. We're so glad you're here, and a big thank you to 3M for sponsoring this event. Our next speaker is Lucy Perry. Lucy is the owner-president of Infection Control Results, a consulting company that is dedicated to reducing the risk of healthcare-acquired infections in acute, dental, and ambulatory medical settings. Lucy has more than 20 years of experience in infection prevention and control, and her presentation today will help you understand the steps required to safely perform cold chemical sterilization reprocessing based on the Centers for Disease Control and Prevention, and also AMI, the Association for Advancement of Medical Instrumentation. This is a great continuation on the discussion that we just had with Peggy Spitzer. So without further ado, I'd like to introduce you to Lucy Perry.
Hi, everyone. I'd just like to point out that I am a certified infection preventionist, and I am also a certified sterile processing technician. A couple of quick disclosures. I don't have any financial interest in any companies. I am using name brands, but they're for illustrative purposes only. Our objectives today are, by the end of this presentation, you should be able to list the required steps to safely perform cold chemical sterilization and understand what items are appropriate for cold chemical sterilization, and lastly, identify how to mitigate safety concerns with this process. So what is the difference between cold chemical sterilization and high-level disinfection? Sometimes the terms are used interchangeably, but really, truly, it is a matter of time. So cold chemical sterilization, if that's truly what you're trying to accomplish, takes hours, where high-level disinfection only takes minutes. So what's appropriate for chemical sterilization? Peggy did go over this. I'll just touch on it very briefly, the Spalding classification. So critical items are anything that enters sterile tissue or vascular system, and those items must be sterilized. Semi-critical are items that contact mucous membranes or not intact skin. The recommendation here from the CDC and, of course, Spalding classification is sterilization is preferable, but if for some reason the item cannot withstand the heat of sterilization or the sterilization processes, then high-level disinfection or cold chemical sterilization would be appropriate. And last, non-critical are items such as blood pressure cuffs that just only contact intact skin. And as Peggy had mentioned, surface disinfectants are appropriate for that. So I can't talk about cold chemical sterilization process without touching very briefly on instrument transport. According to the OSHA bloodborne pathogen standard, a leak-proof container with a lid must be used for any sharp items. And pretty much in dental, almost everything is sharp, so you must definitely use a leak-proof container with a lid. It must have solid sides and a solid bottom. I put the word IFU there to remind us all that the container that you're using, you must be able to disinfect it between uses. So make sure whatever container you're using to transport has instructions for cleaning and disinfection. And lastly, it must have a biohazard label on it or the universal color of red. So what's up with this design? Well, according to the CDC, cold chemical sterilization must be performed in a designated area in which only this process occurs, or similar processes, and I'll talk about that in a second. It must be a clean environment to prevent recontamination of your items once they come out of the soak. Ideally, you would have a separate area for cleaning and decontamination on one side or one area, and then your work would flow to the soak container or the soaking bin where you have your items in there. And that, again, is to keep clean and dirty separated. The designated area really refers to make sure that nothing else patient-wise is going on in there. In other words, your cold chemical sterilization area should not occur in an operatory or in support areas like someone's office, which I've unfortunately seen. Make sure you have enough space for supplies that you'll need during this process. There should also be facilities for hand hygiene. Now, OSHA does recommend, actually, the OSHA bloodborne pathogen standard does state that if your hands come into contact with blood or body fluids, you must wash with soap and water. Many times I'll only see alcohol-based hand rub in these areas, so make sure that you have easy access to a sink with soap and water. And last, I want to just touch as on the eye wash station, that must go on in a clean area. It should not be on the same sink that you use to wash instruments, and ideally should be a separate facility. So we're going to touch briefly on workflow. Workflow should go from dirty to clean. So from the cleaning of instruments and decontamination of them to the soap bin to rinsing and then out the door basically. And ventilation is an important aspect of this because you are working with chemicals. Ideally you would have, if you have a 2-room situation, your dirty side would be negative pressure, your clean side would be positive pressure, which is pie in the sky. Usually you see 1 room. So you want to, if possible, situate your setup so that the air is flowing from clean to dirty and not the other way around. Some of the basic equipment that's needed for this process entirely, of course, you have to have clean and dry items to put into the soap. You need your chemical sterilant. You need an appropriate soap bin, and if you notice this one up here, it has a perforated tray inside so that it does have a way for the instruments to, or the items to lie flat in there, and then it has a nice little handle that you can pull up so you don't have to put your hands into the chemical themselves. You may need a disinfection station. Those are also known as a soak station, and I actually have some examples of that later on. And that is in case you don't have the required ventilation. A recommended ventilation is 10 air changes per hour for this. So if you don't have that, you may have issues with vapors, as Peggy had inferred earlier. You must also, most chemicals have a temperature requirement, so you have to have a thermometer. You have to be able to time various aspects of this, such as the dipsticks, which require a specific amount of time to dip and then to read. And then the next item here is a small container to remind us that you may need a small container depending on what chemical you're using for QAQC testing. And of course you may need paper, you will most likely need paper towels because you need something to rest those dipsticks on once you use those test strips. And then last but not least, you need a way to document what you've done. So I want to start with talking about the chemicals. There are multiple chemicals available. Glutaraldehyde. This is an example of glutaraldehyde. There's the OPA. I'm not going to try and say that, but this is an example of the OPA. And the hydrogen peroxide solutions is the bottom Sporox example. Again, these brands are just for example purposes. Make sure that your products are FDA cleared for whatever it is you're going to use it for. If you're planning on true cold chemical sterilization, you're going to let your items sit for hours, you need to look it up on the FDA website. And you'll see here that in yellow, that OPA has no indication for device sterilization. So you cannot use that chemical for cold chemical sterilization. And you can use it for high-level disinfection, but definitely not for cold chemical sterilization. Where the other two, the glutaraldehyde and the hydrogen peroxide, both have been approved or cleared by the FDA for cold chemical sterilization. So we're going to talk about some very basic principles. So you need to start with a clean bin or basin, which you'll see here, that fits that bill. It does have a lid. However, the problem with this bin is that it is something purchased from a retail store as opposed created for medical purposes. Therefore, the question I would have for this practice is, how do you know how to clean it between uses? When you empty the chemical out at the end of its lifespan, how do you know how to clean that to make sure it doesn't have residual chemical and that it's safe to use to refill again? And you'll also notice what's in this bin are a lot of syringes and some other items which you'll get a better view of very shortly. Those are single-use devices. So single-use devices should never, ever, ever be reprocessed, whether it's cold chemical sterilization, high-level disinfection sterilization. If the package says it is meant for one patient, one use, or single use, then you must dispose of it after you use it once. And one of the basic principles of cold chemical sterilization is the item should be completely immersed. You'll notice here that those syringes are not completely immersed, nor are the lumens full, which is another basic principle. So if you do have something that has a lumen, especially a skinny or a narrow lumen, you have to figure out a way to fill it with that residual, with that chemical, because a chemical must come into contact with all surfaces in order for the item to either be high-level disinfected or cold chemical sterilized. And just a quick reminder, do not reprocess disposables. Pretty much everything on this slide is a disposable item. Just a quick reminder here. So we talked very briefly about 10 air changes per hour are needed. And if you don't have that adequate ventilation, then one possible alternative is a soak station, which is the item on the left. That particular one accommodates flat basins, but there are types that do accommodate something that stands up, like that container on the right. One quick note about if you are going to use such a thing as a soak or disinfection station, they have filters and they do require some maintenance. Pretty much most of the soak stations I've seen, the only true maintenance is changing the filter like every 6 months or periodically, whatever the manufacturer of that soak station requires. On with some more basic principles. I had mentioned that you have to have a thermometer because many of these chemicals will require specific temperature ranges or specific temperatures. On the earlier slide, I did talk about some chemicals require 68 degrees, some have a range of 68 to 77. So you do have to actually take the temperature of your chemical to make sure it complies with whatever the manufacturer recommends. And you can find that on the bottle label usually, or at least on the paperwork that comes with that bottle. I have a watch here to remind us that there is time is involved. And when we talk about time, we talk about 3 different times. There's the reuse time, the soaking time, and then expiration dates. The reuse time is once the chemical is poured into the basin, how long is it good for? So, and you can see here that depending on the chemical and sometimes depending on the manufacturer, you will see wide variation. OPA doesn't have to be changed except for every 28 days, where glutaraldehyde must be changed every 14 days. That's regardless of how it tests. So your soak basin has to be marked with the date that will expire, the amount of time, from today's date to 28 days or 14 days or 21 days, for example. And how long should it soak for? Well, again, this is cold chemical sterilization. So hydrogen peroxide, about 6 hours, most brands, and glutaraldehyde, at least 10 hours, sometimes 12 or 14, depending on the brand. That's another time that you have to monitor. When we talk about expiration date, there's a manufacturer's expiration date that is stamped on the bottle. And then there's also how long is that chemical good for once you open that bottle, because generally you may not use that entire bottle at one time. So I want to talk a minute about the manufacturer's expiration date. Ideally, you're getting good chemicals, but just for a safety concern, Make sure when you first receive the bottle, you are checking the manufacturer's expiration date to make sure it's still good. And then prior to opening, check that manufacturer's expiration date. After opening, some of these chemicals are good for 75 days, some are 90 days. So you also have to keep that manufacturer's expiration date in mind, because that 75 days or 90 days cannot go beyond that manufacturer's date. And those are dates you also need to write on the bottle as well. That's a lot of dates to keep track of. And if you're like me, you're not going to want to have to keep consulting a calendar. So there is a free date calculator that can be used, and the website is on the slide in your handouts. So I did mention test strips. So, geez, why test? You know, if the chemical comes from the manufacturer, it's not expired, why do you need to test? Well, there's several reasons. First, if there's any moisture in the items you are going to soak, they could, over time, or the lifespan of the soaking time, actually dilute the chemical. That's one important reason to test. Plus, you have the assurance that the chemical is of the appropriate strength. Make sure your test strip matches the brand and type of chemical. Many manufacturers will have several different chemicals in their availability. So you want to make sure your test strip matches the brand and type of chemical, not just the brand. Many of the manufacturers will tell you that the chemical test strips bottles must be kept closed at all times. So what do? You walk into your cold chemical sterilization area, you're getting ready to soak something, and you notice before you test the chemicals, the test strip bottle has been left open. So what do? Well, the answer to that, Julie, is it all depends. It depends on what the manufacturer of those test strips recommend. Some will tell you to discard the bottle if it's been left open for any period of time. Others will tell you that it could be, they will recommend quality assurance testing to make sure the test strips are still good before you use them again. So how do you use these test strips? Well, the manufacturers of the chemicals do recommend that you test the chemical prior to every use. That's not every day, that's every use. So if you're going to use that chemical for high-level disinfection, for example, 10 times in a day, you have to check that solution 10 times. And we'll talk about documentation shortly. OPA and glutaraldehyde both require QA or QC testing of the test strips. Those manufacturers, generally speaking, will require that. And we'll go into a little bit more detail with that in a few slides. So the minimum effective concentration is your testing that you do of the chemical each time prior to use. So the test strip bottle will have on the instructions on the label how long you have to dip the strip into the solution. It could be dip it for 1 second, could be dip it for 2 seconds, or even 3. The time to read the strip, how long the strip has to sit after you've dipped it, will vary based on manufacturer and the type of chemical, as well as what to do if the test strip fails. The bottle will have test strip colors on it. So after you dip your strip in the solution, you'll compare it to the bottle, and if it's a fail, what do? Well, pretty much what that means is the chemical's not working. So you would have to dump the solution, discard the solution, clean your bin, and start over, pour fresh chemical in it. I didn't mention QAQC testing. So what's the point? Well, this is your assurance the test strips are truly working, so you're getting good results. You're not getting a false fail and throwing out those expensive chemicals for no reason. There is one brand, one manufacturer that does not recommend QAQC testing. It is in their literature that goes into detail about how to do the QAQC test, but then they'll also have this little blurb in there that says, oh, by the way, we've already tested all of our test strips. We know they're good to go. And if you click on our website, you can get a certificate So if you do use that brand, if you did notice that in literature, and use that brand, you want to print out a certificate every time you open a new lot number of the bottle. So that brings us to when should the test strips be tested for QAQC. Every time you open a new lot number is what the manufacturers recommend. However, in practical application, sometimes it's hard to remember, oh, this is a different lot number, I have to check. And what I have actually seen usually is at most places, every time they open a new bottle of test strips, they'll go ahead and just do QAQC testing. And then, of course, how do you do QAQC testing? This is standardized across the industry. Doesn't matter what brand or what chemical you're using. It is, you have 3 test strips for a positive control and 3 test strips for negative control. And by that, what I mean is you'll take out of the bottle of solution that you're going to be using, you take full strength and put that in a small container, as well as a 50-50 dilution, so 50% of water and 50% of the solution. So you would expect at 50-50, the test strips dipped in that to fail, and you would also expect the test strips dipped in the full strength solution to pass. And if that's not the results you get, then you cannot use those test strips. That bottle of test strips aren't any good. So far we have taken our clean and dry items, put them in a soak container. We have labeled the soak container for the amount of time that the chemical is good for. So we know as soon as we look at the lid that this chemical is good to go. We've tested the test strip. We've used a test strip to test the solution to make sure that chemical is still active and effective as it should. We can put our items in the soak. We've left them in for the amount of time the manufacturer has recommended or required. The next step is rinsing. What I've seen a lot is items being taken to a sink and just rinsed under running water. There aren't any manufacturers of these chemicals that recommend that. Manufacturer's recommendation for rinsing is immersion or submersion. This requires a bin or a basin full enough of water so that the item that you are rinsing is fully covered, and then you gently take that item and you can kind of swish it around a little bit or rotate it to help a little bit with some movement, so which furthers the rinsing. Then you take your item out. You have to empty that. If you're going to use just one container, you have to empty that water you just used, rinse out that container really well, and then refill it. Generally, rinsing is at least 2 to 3 times depending on the type of chemical you're using. So you have to have fresh water for each rinse. So the question does come up, should I be using sterile water or tap water? And again, the answer to that is, well, it depends. It depends on a couple different things. It depends on what is it you're soaking. Some manufacturers of devices will tell you to only rinse it in sterile water. Others will say just water. So in which case the inference there would be tap water. And again, a number of rinses will be dependent on the chemical and the chemical manufacturer's recommendations. So we've been talking about cold chemical sterilization. So is it really sterile? Are the items really sterile when you soak them? I'd like to think of it more as a terminal process, as a true sterilization. Part of that depends on how you handle it. The other part of it is the fact that it's open to the air. So are you using sterile gloves? Are you using sterile water? Are you putting the item in a sterile container or not? Those all will come into context of whether or not the item is contaminated once it has been through this process. So handling after the soak process is extremely important. You want to make sure you're not recontaminating the items once you've soaked them. Documentation is the critical aspect of this because that's your proof. that is your proof. That's your safety margin to show that, yes, I did everything I was supposed to, and the item was processed the way you should have done. So your chemical testing results should, including your QAQC testing, should be documented. The soak time should be documented, as well as the person responsible for soaking. There's some examples of these log sheets. This is a particular manufacturer's log sheet. I do want to point out that it does say across the top is a date the test strip bottle was first opened, and then do not use after date for test strip bottles. They also have a lifespan. Some are good for 60 days, some are good for 90 days. There is one manufacturer who says our test strips are good for 180 days after the bottle is open. And again, you want to make sure that that 180 days or 90 days does not go beyond the manufacturer's expiration date already printed on the bottle. The lot number of the bottle should be recorded. The QC test results, if required, should be recorded, and the date, and then who it was done by. On this log sheet, it does say date solution opened. The manufacturer is assuming that you're going to open that bottle and pour the whole thing into your basin. You might not need to. Your basin might be smaller, your soak basin. So you can change that idea from date solution open to the date the solution was poured, because the next column would also contain, instead of the date solution expires, it actually means the 28 days or 14 days or whatever. Then, as I had mentioned, the solution testing required results, the date and the time, as well as the results, and then who it was tested by. And there is a space here for temperature in degrees Fahrenheit, because this manufacturer does recommend that their product be kept at a specific temperature. I do want to remind you that if your manufacturer of your chemical does have a specific time limit or temperature requirement, you have to have a way to keep that chemical at that particular temperature. I know Cydex OPA, this particular brand, requires a temperature of 77 degrees. So if you cannot maintain the chemical at 77 degrees, you cannot use it. This is another example of a log sheet, very similar to the other one that we just looked at. And again, I want to point out that it does have temperature in degrees Fahrenheit, because this particular manufacturer of these chemicals also has a specific temperature that the chemical must be kept at in order for it to be effective. So we've talked about the basic principles of cold chemical sterilization, which also apply to high-level disinfection. One thing you have to keep in mind is there's a lot of steps with this whole process. Therefore, to be on the safe side, you want to develop a policy, but actually more of a policy and procedure. It lists everything that should be done in your facility, in your dental practice. And I would make it very brand specific, chemical specific, so that if I'm a new employee, I can read that policy and procedure and get a really good idea of how long the item has to soak, how long is the chemical good for, and how to do the testing. That policy should be used to form the basis of a competency assessment. A competency assessment should actually be direct observation of the whole process by a knowledge of the person. And then, of course, your orientation checklist to ensure that whoever's doing the orienting of your new employees is always doing it in a standardized manner. And that orientation checklist should be based on that policy and competency assessment. And once the new employees through their orientation, of course, then they should undergo a competency assessment to ensure that they can do all steps from A to Z in this process thoroughly, completely, and properly, because it is a patient safety issue. The chemical sterilant and test strips will have its storage requirements as far as temperature in the unopened state. So you want to check your label and make sure you're storing them according to their requirements, as well as checking the directions for use. Disposal will be based on the chemical. Some chemicals require a neutralizer kit, some do not. However, that really is based on your state, local, or federal law. So you might want to check with your safety person to find out, is this something I can dispose of down the drain and pour a lot of cold water down the drain as it goes, or do I have to have a neutralizer kit? If you need a neutralizer kit, then you need to consult the chemical manufacturer's information, directions for use, to find out what is the appropriate neutralization kit so you can have it handy. So some issues with mitigation. If you have lack of 10 air changes per hour, lack of ventilation, poor ventilation in the area, you can use a soak station or a hood. The neutralizing kit for disposal we just mentioned. Room ventilation is an issue. Best if it is from clean to dirty. I do want to point out that, as Peggy did talk about chemicals, the glutaraldehyde has a permissive exposure limit, or a PEL. So you may need to wear a badge similar to what you might have to wear for x-rays to ensure that you're not being overexposed to the dangerous chemical. Again, that's something you'd have to check with your safety officer. Last but not least, I'm going to compare what ADA and CDC both say about cold chemical sterilization. Pretty much the ADA says, well, there's limited need for it in dentistry. But you may have to soak for up to 10 hours to actually achieve cold chemical sterilization. And they do recommend that if you are doing cold chemical sterilization, that you use rinse with sterile water, you dry the item and put it in a sterile container if you're not going to use it immediately. CDC, on the other hand, says, well, if it's heat sensitive, pretty much replace it or get a disposable. You know, replace it with something that can be sterilized or get a disposable alternative. And then if nothing, there's no disposable alternative or no heat tolerant alternative, then you should, at a minimum, use high-level disinfection. And some guidance and resources here are listed. And the last thing I want to talk about is, we call it cold chemical sterilization, but is it really sterile? Sterilization is, I think, in that is a bit of a misnomer, because once the item is exposed to the air, it is no longer sterile. So just be aware that if you're using cold chemical sterilization, you are not getting the same level of protection for your patients as you would if you were actually using a steam, dry heat, or chemical vapor sterilizer. Okay, and do we have any questions?
All right, Lucy, thank you so much for sharing some information on cold chemical sterilization and really continuing the discussion that Peggy started right before this session. We do have some great questions for you that came in. So I'm just going to start off by asking this one. The first question is, what are the typical concentrations of sodium hypochlorite for dental sterilization of instruments?
Sodium hypochlorite, I have not seen any chemicals approved by the FDA for cold chemical or high-level disinfection of instrumentation.
Okay, that's a great answer to that question. Thank you. Can cold chemical sterilants be used to soak instruments before placing them in the ultrasonic?
Oh, that's a great question. I'm so glad you brought that up. I have seen that in practice, but there really isn't any reason for that. The cold chemical sterilization chemicals, your items should be cleaned before you put it in there. So why would you want to clean them again if you already cleaned them? Plus the fact that cold chemical sterilization or high-level disinfection, those chemicals are very hard on your instrumentation. So if your items can be put in the ultrasonic and sterilized, there's no need for those expensive chemicals. You're much better off using an enzymatic cleaner to soak your items in to keep them moist until you can actually clean them. Then put them in the ultrasonic and the appropriate enzymatic detergent to thoroughly clean them.
Okay. And going back to the previous question, I believe the reference was actually to sodium hypochlorite bleach. Do you know what the proper concentrations for that chemical would be?
For bleach to soak instruments?
Let's see. Let me bring up that question one more time. Yeah. What are the typical concentrations of sodium hypochlorite bleach for dental sterilization of instruments?
Okay.
And should it be used on instruments? I guess that's the main question. Okay. Should it be used on instruments?
All right, good. All right. So to answer your last part, should it be used on instruments? No. I don't know of any bleach solutions that have been approved for use on instrumentation. I'm a big advocate of only using items on instruments that are meant for instruments. You know, whether it's cleaning tools or whether it is the chemicals themselves. If it wasn't made for instrumentation, it's going to damage your instruments over time.
Okay. This next question says, given the chemical hazards and risks, what type of dental device should be processed with cold chemical sterilization?
That actually depends on the manufacturer of the instrument or the device's recommendations. The instructions for use or the directions for use of the item will clearly tell you how to reprocess. And those reprocessing instructions are cleaning and sterilization instructions, and they will tell you whether it can undergo steam or dry heat or chemical vapor sterilization or none of the above. And truly, what I didn't say in my formal presentation is I have never, ever, ever in 20 years seen cold chemical sterilization or high-level disinfection performed in dental practice properly. Usually my recommendation is don't do it. There's so many steps and there's so many ways it can go wrong. So if you can avoid it at all, that's truly the safest thing for your patients.
Okay. And that actually plays well into this next question. It says, does cold chemical sterilization, is it less harsh on instruments than standard reprocessing?
No, it is not. You're actually soaking something in a very corrosive solution for, if you're trying to sterilize for 6 to 10 hours, as opposed to steam sterilizer, which uses water to create steam vapor for just minutes, is the total amount of time that the instruments are being exposed to something.
Okay. This next question says, not all chemicals can be used on all items. I'm sorry if I missed this, but is it your recommendation that the IFU indicate which chemical to use if you choose to do cold chemical sterilization?
Yes, always follow the IFU or DFU for the reprocessing instructions. Some device manufacturers will be very specific. Only use blutaraldehyde or only use hydrogen peroxide. Others will actually tell you a specific brand. For the manufacturers that don't mention a name brand product, they will tell you blutaraldehyde in a certain percentage or OPA in a certain percentage. And that truly is all you should be using for soaking, should you need to do that.
Okay. This next question says, can you share some stories from the field that highlight common issues you come across when you survey dental offices?
Ooh, where to start? Sterilization and high-level disinfection or cold chemical sterilization are processes fraught with many problems. Frequently with sterilization, I'll see wet instruments. actually I'll see them pill pouched, still wet, on a towel on the counter. And as our previous speakers have mentioned, if the instruments are coming out of the sterilizer wet, you have to unpackage them and totally reprocess. That means re-clean them thoroughly, re-dry them, inspect, repackage, and re-sterilize. That's one of the big things I see. And sterilizers not loaded properly, usually overloaded, because your practices are so busy and you're using small tabletop sterilizers. Those are probably the biggest issues I've seen. And again, cold chemical sterilization, don't do it. It's very fraught with problems.
Okay, this next question, what information should be documented in a logbook for chemical reprocessing?
Well, let me go back. Okay, so all your test strip bottle information, the date the bottle was first opened, and then how long it can stay open, the beyond use date, in other words, that is based on the test strip manufacturer's label. The bottle lot number, if you have to do quality assurance or QC testing on the test strips, that should be documented as well. The results, the test date, who did the testing, and then for the actual solution, the date the solution is poured, the date that it expires, in the bin, in the basin, the date the solution is, the test date, who it was tested by, the results of the test, the temperature. If you have like you're doing a specific device that you are soaking, then I would also document that device, the name, the serial number, model number, product number, however you can document that, so that you have proof should something come back at you later. In an ideal world, you would know who that device was used on that you're preparing to soak, so that should that patient come back and say, hey, I have an infection, it's all because of you and your practice, then you have clear documentation that everything was done properly, everything tested right, the item was soaked for the proper amount of time. It helps protect you and your practice. And then, of course, the tested by who actually did the initials. The initials of the person actually did the soaking. Sorry, my head was faster than my mouth there. One thing that's not documented on any of these manufacturers' test log sheet examples is you have to have a place. I would strongly recommend creating your own sheet and have a place in your logbook to document the date that the solution was opened. If you don't pour the whole bottle into one container, then have a place to document the date that bottle was opened and its expiration date, either the manufacturer's expiration date, if that's before the 90 days, or however long that bottle can stay open on the shelf. Okay. Kind of a long-winded answer to a short question.
That's great. This next question, sort of related to a previous one, can a cold chemical sterilant be used in an ultrasonic?
No. Cold chemical sterilants are actually meant to sit still for soaking. When you put something into an ultrasonic, you are generating heat. You have, for most ultrasonics, the tabletop models at least, you do not have a method or way to control that temperature, plus the cavitation. You're actually, aside from all that, sorry, I talk with my hands. Aside from all that, the one thing you want to remember is those are two separate processes. The point of the ultrasonic is to clean your instruments. The point of the soak is to high-level disinfect or cold chemical sterilize, kill the cooties, basically. So you're having is two separate processes, and it needs to be handled that way as well. Next question.
Okay, next question says, can leftover local anesthetic cartridges be placed in cold sterilization for 1 or 2 hours and rinsed with water or saline, allowed to air dry, and then be reused?
That's an excellent question, and that has really to do with patient safety. It's a big patient safety issue in dental. The short answer is no. Now let's go into why. Why am I saying that? Well, these dental carpules are meant to be used for one patient only. Remember my big thing about do not reprocess single-use devices, right? That dental carpule is meant for a one-time use only. If you save it and try to use it on another patient, you are going off-label, which could open up your practice, you personally, your facility where you are working, up for liability. Plus, you don't know the quality, again, of the medication that you're actually giving to the next patient. Now, with that said, my question to you would be, so how are you cleaning that carpule? Where are the instructions for cleaning the exterior part of that carpule before you put it into that sterilant? There are none, because it is a single-use item, and you cannot reuse it. That's not a safe practice. Next question.
Oh, okay, wonderful. This next question says, should an N95 respirator be worn when working with glutaraldehyde?
I have not seen that PPE recommended by any of the glutaraldehyde manufacturers. Certainly you should be protecting your respiratory system as well as your eyes and gloves, and potentially a gown if there's potential for splashing. If you're pouring the jug, into the basin, then definitely wear a gown. If you're rinsing the items after, I would definitely wear a gown or something, something to cover my scrubs to protect from splash. In addition to the other PPE. But as far as the N95, I've never seen that required or recommended by any of the manufacturers. But remember, if you're wearing an N95, you want it to protect your respiratory system, you should be fit tested first. If you are not fit tested, that N95 may not be doing any more than a procedure or surgical mask. Your regular mask, in other words. Next question.
Okay. Could the cold sterilization process replace heat sterilization safely and effectively?
No. The reason for that being that not all, this is kind of a tricky question. So if you think about sterilization, the point of sterilization is to kill everything, right? Okay. So some of the chemicals used for cold chemical sterilization, like hydrogen peroxide, can kill spores. But not all chemicals will kill spores. And of course, if you're putting, if you want something to be sterile, you want the spores to be killed. And that's kind of the short answer. Plus the fact that with steam sterilization or dry heat sterilization or chemical vapor sterilization, you have a way to monitor the sterilization process as much more reliable than the test strips that you're using for the cold chemical sterilization. I'll reiterate it again. If you can get around and not do cold chemical sterilization, don't do it. Next question.
Okay, this next question says, could cold sterilization be effective for plastic dental instrument sterilization?
That would truly depend upon the instrument manufacturer's directions for use and what they say you have to do to be processed. I know there are some dental hand instruments that have like a plastic coating on them, but I've seen those actually are safe for steam sterilization. As far as items made totally up of plastic, I would check with that manufacturer's instructions and see if they are single-use devices. I know in that one picture that I had on my slides with all the stuff laid out, that was a dry field system, and that was one of those, here, let me see if I can find that slide. Ah, there it is. Okay, if you can see this, the little tubing there, that's actually part of a dry field system, which by the manufacturer is a single-use device, that particular brand. These impression trays are also single-use devices. So, as I've said, what I've seen mostly in dental for items that are totally plastic like that, a lot of them are single-use devices. So the first thing I would do is check your device, your items manufacturer's reprocessing instructions, and see if it can, if it should be used for more than one patient. And then from there, assuming it's made for multiple patients, what is the manufacturer recommending? How do you clean it properly to ensure you have decontaminated appropriately? And then what's the next step? Does it require cold chemical sterilization, high-level disinfection, or sterilization through steam, dry heat, or chemical vapor? If you find that whatever the manufacturer says you cannot do, then don't use that item, because it's not safe for your patient. You're putting your patients at risk. Next question.
Okay. This question says, what is the difference between cold sterilization and high-level disinfection? And if they're the same thing, why the difference in terminology?
Okay. I tried to make that point when we first started. The main difference between cold chemical sterilization and high-level disinfection, generally speaking, is timing. To high-level disinfect something, depending on the chemical, can take as little as, 15, 20 minutes or less. If you actually are trying to do cold chemical sterilization, the least amount of time I've seen is 6 hours, and that's for hydrogen peroxide products. And the longest I've seen is 10 to 12 and sometimes even 14 hours for glutaraldehyde products. So that's part of the difference. The cold chemical sterilants have been approved for that process because they have a better kill, according to the microbiological testing, than the chemicals that have not been approved for cold chemical sterilization. The principles are the same, however. Okay. Next question.
Yes, next question. So again, related to this, to clarify, the main difference between HLD and cold chemical sterilization is the type of chemicals used and the exposure time frame that's required. It is my understanding that HLD cannot kill spores, but can you explain why dental offices might use chemicals that require longer soak times, especially when they have such high pressure to turn over instruments quickly?
This is kind of the bane of my existence, I think. This picture is actually from a practice I visited. These items were actually all being soaked in a cold chemical sterilant. A lot of those items were being used by orthopedics. It was a very large practice, and orthopedics traveled in, periodically. So they would actually go ahead and they managed all the soaking. The dental assistants that were not associated with orthodontics, orthodontics did not have anything to do with the chemicals. This was a money-saving thing that they did. I mean, that is the only thing I can think of that people are trying to be financially or fiscally responsible, and therefore are soaking items. Can you repeat that question for me? I'm not sure I answered that.
Sure. So what it says is, it's my understanding that HLD cannot kill spores, but can you explain why dental offices might choose chemicals that require longer soak times instead of, for example, sterilization, when they have such high pressure to turn over instruments quickly?
don't have a good answer for that. When I ask people why you're doing that, or I go to practices and say, well, why are you doing that? The response I usually get is, we've always done it this way. Again, I think because people are trying to reuse items that perhaps they should not, like single-use devices, like the syringes, for example, on that slide. There aren't any instructions for single-use devices for how to reprocess, because you're not supposed to be. And that, I think, is one reason. The cold chemical sterilization probably or possibly gives people a better sense of security, because it's cold chemical sterilization, as opposed to high-level disinfection. It doesn't sound like it's safe for your patients. Again, some of the literature will tell you that, for example, hydrogen peroxide has a good log reduction as a sterilant, even at 6 hours. But glutaraldehyde may take 10 hours or longer and may not necessarily achieve the same level, the same log reduction level of microbial activity. So why are they doing it? Beats me. I strongly recommend, if the item can be sterilized in a sterilizer, preferably steam, so it's safest, then put it in the steam sterilizer and move on. Because once you take something out of that soap container, it could become contaminated again, especially look at how you're storing it. If you store it in a dirty drawer, now it's no better off than when you took it out of the patient's mouth, truly.
Yeah, great point.
Next question.
All right, this next question says, how can I explain to my peers in my dental office that an instrument reprocessed by cold chemical sterilization is not truly a sterile practice because the items are not packaged and therefore exposed to contaminants? I get it, but how do I express that and get the peers in my dental office to understand that as well?
You could try doing a direct comparison between your steam sterilization process and your soaking process, because now I'm going to make a wild assumption here that I'm assuming that you're taking your dental instruments that are going into the steam sterilizer and you're packaging them, right? So what's the rationale behind packaging them? Well, the outside of the package, once it's removed from the sterilizer, is no longer sterile, but the contents are sterile. And it keeps the instruments from coming into contact with gross contaminants, but also from air and from contamination by handling. You don't have that layer of protection in the items that you soak. As soon as you take them out, they're exposed to the air. So they could potentially become, contaminated by whatever's floating around in the air. They, if they're close to a dirty area, for example, a lot of times these soak stations or soaking areas are in the same area where you're taking care of all your instrumentation and sterilization. So if they're very close to that dirty sink, they could get splashed in that dirty sink while people are washing instruments as you're trying to get yourself out of the soap. And then again, are you rinsing it with sterile water? Are you, if it's tap water is not sterile, right? So you're introducing contaminants to that item. Yes, I realize we're talking about the mouth. I realize we're not talking about somebody's heart. I get that. But still, you don't necessarily know the status of your patients. You don't necessarily know who's immunocompromised. They may not own up to that necessarily. So you really want to have a larger margin of protection. The best margin of protection for your patients is sterilization as opposed to soaking an item. And if you still have question about that I understand this is a complex question. I'm trying to answer it real quick. But if you still have questions and you feel like you didn't quite get what you need, my contact information should be on the handouts, I believe. So feel free to contact me for further info. Next question.
All right. Wonderful. And this will be our last question for the session. It says, can you talk about the water quality required? for rinsing after soaking a device in any chemical reprocessing solution?
The quality of the water is dependent upon what the device manufacturer recommends. Some devices will recommend sterile water. Others will just say water. Just rinse it in water, which is usually tap water. I realize that for instrument sterilization, when you hand wash instruments that are going to be sterilized, the true recommendation for that has to do with water quality, to use RO, DI, or distilled water for rinsing, but there is no equivalent recommendation for high-level disinfection or cold chemical sterilization rinsing. Okay. Lindsay, I can't hear you.
Gotta love the mute button. All right, I'm gonna actually make this next question the last one. I'm glad it's me that did that instead of someone else. I took one for the team. Welcome to 2020. All right, which kind of acceptable room sterilization would you prefer in dental offices along with effective results?
Can you repeat that question for me? What type of room sterilization?
Yeah, and I'm wondering which kind of acceptable room sterilization would you prefer in a dental office with effective results? And I'm not sure if they're referring to actual room as in environmental cleaning, but let's stick to the topic of instrument reprocessing. What do you recommend for dental offices for sterilization? Is it cold chemical sterilization, high-level disinfection? Is it high temperature sterilization, et cetera?
Yeah, the cheapest and the easiest sterilization method still is steam. And that's what I would recommend. If your instruments are heat tolerant, then steam. If they're not heat tolerant, and then you can see if the manufacturer of the instrumentation recommends a chemical vapor sterilization. And I say that very carefully because chemical vapor sterilizers, some of them, are use formaldehyde, and I would be very hesitant to bring that into my practice, actually. So if the item cannot undergo steam sterilization, I would look for a replacement that could, or disposable.
Okay.
That, again, is the best safety margins.
All right, Lucy, thank you so much for sharing your insights today on cold chemical sterilization. If anyone has additional questions for Lucy, her contact information can be found in the speaker bio tool on the lower right-hand side of your page. As a reminder, there is a 15-minute break between this session and the next. If you find yourself on the registration page for the next session, you can certainly click on Already Registered and enter your email address to enter the session. We're glad you're here. We hope you get some refreshments in the meantime, and we'll see you all in about 15 minutes.